Good morning. Good afternoon, everybody. Thank you so much for joining us for this seminar. My name is Sabri. I'm a researcher at the Institute of Nutrition, Mahidol University. We're here today to hear a lecture by Dr. Jody Harris, adjunct professor at the Institute of Nutrition, Mahidol University, and also affiliate with the Institute of Development Studies in UK. So Dr. Jody, she holds research leadership positions exploring practice, politics, ethics of food and nutrition policy, academic background across public health and nutrition, and also public policy. So bridging nutrition with policy. Focusing really on an equity and an ethics lens to understanding how people can eat healthily from a socio-political perspective, and investigating the policy processes in international, national, local food policy contexts, considering equity and broader ethical issues in nutrition for development, in particular with a focus on enabling healthy diets for all. And Dr. Jody also has been with us at the Institute of Nutrition since the start of 2024, working with us on food environment research, policy research, and also encouraging and facilitating with us connections with other Mahidol faculties and other national and international groups involved in food and nutrition. So she has over 15 years of engagement in international nutrition and food policy in terms of academic and implementation work in many different global spaces. Over 50, I think outdated now, peer-reviewed publications, book chapters, edited volumes for many academic audiences, which have been cited many times. And she is extremely experienced in policy and qualitative work, and food environment and food systems work. So we're very happy to listen to Dr. Jody today on the topic of her recent work with the World Vegetable Center and now with Mahidol on COVID-19, the impacts on food systems in Asia, consequences for healthy diets through policy, economic, and social lenses. So with that, I'm very happy to hand this over to my esteemed colleague, Dr. Jody Harris. Thank you so much, Dr. Jody, for joining us today.
Thanks so much, Sabri. Thank you for a lovely introduction. And thank you also to ㍍Adjunct and to the Institute of Nutrition for hosting me. It's really great to be here. So as Sabri said, today I'm going to present a set of 3 studies. It's across Thailand and the Philippines. And it's looking at how determinants of healthy diets have been affected through changes in food environments and food policy in both countries through this major shock that we've all just lived through of COVID-19. So let's see how this works. Yes. So a bit of background first. So my work in general is concerned with how healthy diets can be achieved by everyone, everywhere. So from a nutrition perspective, the reason we work on healthy diets, and people here will be well aware of this, is that poor diet causes more deaths globally than any other risk factor. So this chart is a little bit old now, but nothing much has improved. So worldwide in 2017, poor diet was linked to 11 million deaths. And of course, not shown here, but even more disease and disability. So even before COVID, the problem was that diets in both countries, Philippines and Thailand, already did not meet international recommendations, right? So I'm going to focus a little bit here on vegetables as part of a healthy diet, because a lot of this work was done with the World Vegetable Center, but also because it's a really important part of diets and a really important food system issue. So for vegetables, even before COVID, the global target is around 200 to 300 grams of intake per adult per day. And the global average actual consumption per person per day is less than 200 grams. The regional average for here in Southeast Asia is a little bit more, just over 200. In the Philippines, the average intake per person per day is around 110 to 130 grams. And in Thailand, between 90 and 150 grams. It varies a bit depending on what data you use. But basically, it's too low in both countries. So this shock of COVID to the food system intervened into an already imperfect food system. So then we all know very well how much these two countries, along with many other countries, were affected by COVID. So this shows COVID cases and deaths. This is just up to the end of 2021, which is when we designed these studies. So our aim was to better understand what did this pandemic, as an example of a major shock, mean for different drivers of food systems and, of course, healthy diets. So we chose what at that time in early 2021 were quite differently affected countries. They had quite different sets of food policies and different sets of COVID-related lockdown approaches. So we chose Thailand here and the Philippines. And what this study aimed to investigate is what happened to policy, to the economy, and to society with direct relation to food systems for healthy diets over the first 2 years of COVID-19. So these were three separate but like interrelated studies. So for policy, we looked at the policy process. So we looked at change in written or implemented policy. And we also looked at reasons for that change according to people who were involved in those changes. For the economy, we looked at cost of a recommended diet. So we looked at food costs before COVID-19 and then affordability with income reductions and supportive policy. And then for society, we looked at experience of food environments. So it was qualitative work based on food environment and food behavior frameworks. And we really focused in on the most marginalized communities, those most likely to be affected by that shock, by the pandemic. So I'm going to present findings briefly from all three today to tell the story of COVID and diets in these two parts of Asia, which I think can reflect more broadly on the regional experience. So obviously existing policies shape what can be done in response to shocks like COVID. So we wanted to first understand the policy landscape and then policy change during early COVID related to food systems for healthy diets. So this article, the first article, is under review now at the International Journal of Health Policy Management. So I'll share that as soon as it's ready. So of course, governments, both governments and all governments have a lot of policies, strategies, guidelines, pieces of legislation in place across the food system already. It already exists. So in ASEAN, there are regional guidelines on developing food security and nutrition policy, for instance. In 2020, just before the pandemic, the Philippines launched its national food policy, which aimed to kind of bring together lots of different sectoral policy related to food systems. Thailand has a lot of policy. We also had events and discussions on food policy around the UN Food Systems Summit process. So both countries already had lots of policy in place. The point is there was a landscape of policy in place when COVID hit, which conditions then what could be done during the pandemic. Then COVID hit, and we wanted to understand how that affected policy. So this chart shows the combined severity of COVID-related kind of lockdown policies. So this is done by a group at Oxford University. And this provides some background. So there were relatively severe responses, lockdown responses, health responses, others in both countries that restricted us, right? We remember this well, restricted our movement, restricted our activities. You can see that the Philippines had slightly stricter COVID policy responses through most of that pandemic than Thailand did. So those of us here in Thailand perhaps remember that the borders were closed relatively early, but that meant that daily life in Thailand could continue a little more freely. So this was an assessment of sort of COVID-related lockdown policy. But what these metrics don't focus on specifically are changes in food-related policy, food system policy. So that's what we wanted to understand in our study. So I don't expect you can read this, but I'm just showing you what we did. So first, we mapped a policy timeline of lockdown actions introduced by government, and we color-coded them according to that severity in the timeline on the last slide. So this is the red, orange, yellow, and green colors, with red being the most severe. And then next to it, we mapped the COVID mitigation policies that were introduced by governments to support people through COVID and through these lockdowns. And we looked specifically at ones that had a relation to food systems. So it's these pink and blue colors. So this gave us a kind of timeline of food system related policy changes during those early 2 years of COVID-19. So new policy and actions to mitigate the impacts of the virus and of the lockdown policies were in 4 categories, those ones at the bottom. So we had policy that aimed to keep food flowing globally and within national borders. So things like dispensations on transport, shop opening, flow of goods, that kind of thing. So that's, we've colored purple. Then we had policy aiming to stimulate the economy broadly through national tourism or international loans, and those are in the light blue color. Then we mapped some major actions by civil society, things like the community pantries and that kind of thing, where they reach scale. We've got those in pink. But the most action by far was in the area of social protection. So it was largely either through extensions to existing social protection systems or sort of one-off cash grants or multiple cash grants to different groups. And that's in the dark blue. So social protection came up as this really important thing in policy. And social protection encompasses policies and programs designed to safeguard individuals against poverty and vulnerability and social exclusion through their lives. It's this very broad set of actions. It includes things like social insurance, pension schemes, labor market programs, and direct cash transfers. So Thailand introduced lots of different social protection policies for different people and to address different issues over the first 2 years of the pandemic. The Philippines had some specific policy, but it largely contained all of its key mitigation policies within a thing called the Bayanihan Act that was building on established cash transfer programs. So the point here that I want to make is written food policy didn't change very much as a response to COVID. What changed was short-term legislation addressing specific part of the food system in response to whatever the perception of need was in each country, and especially social protection. So then we wanted to understand how and why diet-related food system policy changed to focus so much on social protection. Why was this the main thing that came through in terms of a food system-related policy change? Why were these changes decided? Why were they enacted in these ways? So we used a policy analysis framework called the multiple streams framework to understand that process. We analyzed interviews with policy actors close to these changes in each country. And the multiple streams framework says that for policy change to occur, as it did, a window of opportunity has to open in one or another streams of activity. Either the problem stream, where an issue rises up a policy agenda through a sort of event or through successful framing of an issue by a policy community. So that's if we frame the problem right. The second is the politics stream, where the political context becomes conducive for policymakers to act on an issue. And the third is the policy stream, where there's a solution presented clearly in response to a policy issue. So we found that policy windows enabling social protection to become the major COVID-19 mitigation policy for food and diets opened actually in multiple streams at once, because COVID was such a pressing, overwhelming issue, as were the issue of lockdowns in both countries. So the window of opportunity was opened in the problem stream through concern about the social and economic impacts of COVID and the lockdown policies. Then there were entrepreneurs, policy entrepreneurs, ready with the policy solution of scaling up existing social protection systems. And there was evidence existing to back that up. And then giving this overwhelming scale of regional and global consensus on the pandemic, there was very little political constraint to policy action. So all of that led to the joining of these three streams and to rapid policy changes that really favored social protection. So the findings in this context agree with the broader literature that social protection is really key to supporting healthy diets in times of these shocks like pandemics. So having existing social protection policy is really key to maintaining an affordable diet alongside affording everything else that we have to afford in times of shocks. So it's already well known that there are strong links between social protection measures and food security and nutrition outcomes. Several other COVID policy studies also found that social protection policy, and particularly existing social protection systems that can be scaled up with need, is really crucial for the welfare, particularly of the most vulnerable populations. So our work here adds to that evidence, and it adds to it for food systems and healthy diets. Social protection can, in that sense, be seen as a food systems policy to protect diets. So that was the first of the three studies. So our next question in our next study was, did that policy change get the needs and responses right? So specifically, did social protection keep healthy diets affordable? So this study is published. It's available to read if you want to look it up. So cost and affordability of different foods is a really key part of the food environment that shapes our diets, of course. So the cost is, of course, how much money you have to spend on food. It's usually given in a dollar or other currency amount. And then the affordability is whether you have enough to be able to spend that much. So it's often assessed as a percentage of your income or household income. So compared to what people have to spend, it's generally more affordable to buy a calorie-sufficient diet than a healthy diet that contains all the nutrients and the other things that a person needs to be healthy, including, of course, vegetables. So globally in 2020, so again, just before the pandemic, 3 billion people could not afford a healthy diet. So almost half the planet, and obviously a lot of people here in Southeast Asia. So in 2020, the diet recommended by the government cost an average of 67 US cents per person per day in Bangkok. And of that, around 40% was the cost of staple food, so mostly rice, and around 13% was the cost of vegetables. In Manila, in the Philippines, the average cost of the government recommended diet was twice as high. It was $1.43 per person per day. And of that, 38% was the cost of the staple foods and around 19% of vegetables. So the figures at the top show the extent to which food expenditures were adequate to meet the minimum cost of the recommended diet before the pandemic. So Bangkok residents spent on average about 1.8 times the minimum cost of the recommended diet. They could have spent less and still achieved a recommended healthy diet. While in Manila, residents only spent about half of what is minimally required to eat healthily. So they needed to spend more. The costs of food are different. So food price data from each country show that the initial lockdown, it had no effect on the price of vegetables in Bangkok. And in fact, the overall cost of the recommended diet declined very slightly by about 3%. In Manila, COVID resulted in a slight increase in the cost of vegetables and fruit, about 7%, but the overall cost of a recommended diet did not change. So really the cost of food was not hugely affected by COVID in these cities. The cost wasn't the problem. What was affected was people's ability to afford it, right? So as background, we know formal unemployment really jumped in both countries. and informal workers, which make up a huge proportion of the workforce in Asia, were particularly hit hard by lockdown policy in response to COVID. So in our findings, almost all households in the data in Bangkok could, in principle, meet the minimum cost of a recommended diet before the COVID-19 pandemic. But in Manila, 40% of the sample already before the pandemic could not afford the minimum cost of a healthy diet. So that's around 5.4 million people when you expand it to the whole of Manila. Then during COVID-19, we estimated a 20% reduction of the household food budget. And with that, the minimum cost could then not be met by 14% of the sample in Bangkok. So that's 2.3 million people. And in Manila, there was a similar 15% increase in the number of people unable to meet the minimum cost. So almost 2 million additional people then not able to meet the minimum cost of a recommended diet during the pandemic. And of course, we know that, some people lost more than 20% of their income through COVID. So our calculations were a relatively conservative estimate. And then we looked at whether the government relief funds, whether the social protection systems during COVID-19 helped. So with the government relief funds, the minimum cost of the recommended diet would in principle be affordable to almost everyone again in Bangkok, assuming that the relief funds were spent quite evenly over time and that other costs didn't increase. So that's big assumptions, but still. And in Manila, the population unable to afford the minimum cost during COVID would reduce only by 5%. So there are caveats. For instance, we know that not everyone was able to access those relief funds. But overall, affordability of diets was a really key issue in both cities. But in Manila, the social security provided by the government did not go far enough to protect recommended diets, whereas in Bangkok, in theory, it did. So again, our findings are consistent with other studies of how diets are affected through price and affordability in different shocks. They also suggest that social protection needs to be better designed to reflect the cost of a healthy diet and better targeted and distributed to ensure that it really does help the most marginalized. So there are also implications for research and for government data. So data is very limited to understand food prices and affordability, especially of vegetables. And we don't really know who missed out on social protection as well. So there's already been a lot of work on social protection and food and nutrition. There are guidelines for governments to draw on. There are current projects working with governments to support them in collecting the right kind of dietary and food price data so that we can make these calculations more routinely. So we can obviously support those. So that was the second study, economy. So now onto society. We know how policy changed towards social protection. We just saw that. And we know how this change affected people's ability to afford healthy diets at the population level in those two countries. So lastly, we really wanted to understand how people had experienced those changes. And in particular, how did the most marginalized and the most nutritionally vulnerable populations experience those? So study 3, this one is also published. It's available to read. So the ways that people get and consume food is more complex than just policies and prices, of course, we know that. So the idea of the food environment, which is this figure here, captures both the sort of external issues involved, the issues that are common to populations in a certain context, and also the personal issues involved, so the individual aspects of food. So we wanted to understand whatever of these issues were affected for people in Bangkok and Manila during COVID. So there are a set of methods known in food research as lived experience methods. They're similar to ethnography and anthropology or to kind of participatory research methods in development studies. And so we used largely in-depth interviews in this work and then combined with observations of people's environments. And because we knew that the most marginalized population groups would likely be both less able to cope with the shock of COVID, and also possibly less able to access some of the social protection measures available, we really carefully sampled people from the most marginalized populations in each context. So in each city, in Bangkok and Manila, we went to both an urban and a peri-urban location to capture the different experiences of people who, potentially had perhaps space to grow their own food or their own vegetables. And then within those areas, we sampled low income or slum areas specifically. So that was sampling the areas. And then to sample the people, we looked in the literature, we spoke to local experts to understand which populations would be most marginalized in those areas. And we decided on a set of people, including daily wage earners, street vendors, the unemployed, and migrant workers. And so we worked with local authorities to identify and approach people to talk to. And just to give a sense of some of the communities and how they access food, we took some photos with permission, of course. And from these places came some really very powerful stories of COVID disruption to healthy diets, but also some very positive stories of how people overcame those challenges. So we use a lot of quotes from respondents in the paper. You'll see if you read it. And the title of the paper came from this lady in Manila. It kind of seemed to sum up some of the experiences. So she said, whatever we have is what we eat during a pandemic. And this very often we found did not include healthy foods such as vegetables. So we analyzed the interview data through rounds of qualitative coding and according to what's already known about food environments to understand really what were the aspects of people's food environments that were affected the most and how did they experience their food environments during the pandemic. And there were 4 big themes that came up. So 2 of them were on the challenges that people face. So around financial hardship, for instance, loss of income, financial stress, and loss of personal agency. So for instance, mobility restrictions and lack of choice around the food types that they could eat. And then there were 2 themes on the ways that people overcame those issues. So one was around ways that people approached daily survival, things like rationing food, eating less, finding schemes to get around restrictions, and one on social support networks, things like family financial support and community sharing. And at the very bottom there, you can see the code on government assistance, which is essentially social protection. So most respondents from both countries claimed they benefited from government cash assistance and that alleviated a portion of living expenses. But some residents, particularly in the Philippines, described government aid as insufficient. Obviously, that agrees with what we saw in the previous study on affordability, where social protection in the Philippines was not enough to protect diets. And while government assistance was in place, vulnerable groups in society explained some difficulties in accessing that assistance. So people obviously in quarantine were unable to line up and receive cash. The elderly were unable to endure long, hot waiting lines and got exposed to the sun. And sometimes aid got political, so according to some people, so linked to votes and that kind of thing, again in the Philippines. So I'll also add that formal social protection was one of a range of measures that people took to maintain their food security and their diets through the pandemic. But where social security is accessible, where it's sufficient, fewer of the more kind of risky coping mechanisms and schemes needed to be employed. So it's important that communities are resilient to shocks, of course it is, but it's important that crisis is not normalized and that people are not just abandoned to their own kind of coping strategies. So a lot of the literature on social protection talks about how to make social protection targeted properly or even universal for everyone, so that it's always accessible for those who need it. Okay, so that's the 3 studies, policy, economy, and society. So I'll just speak for another couple of minutes on what does that mean? Why is that important? So in the policy study, we really didn't start looking specifically at social protection policy. We were looking broadly at what policy had changed or added to across the food system in response to COVID. But we found that a large majority of that really was social protection policy. And we found that the reason for that is that policy entrepreneurs were ready with evidence about the efficacy of this kind of policy and about how it could improve food and diets when COVID sort of opened this window of opportunity for action. So today we're talking about COVID-19, but I think it's important to note that this is not the first shock to global food systems. This shows shocks just since 1990, and it won't be the last shock. Sadly, we know it won't. So even though those shocks might look different every time, an economic shock or a pandemic, we know it will happen again. So that's why we did this study, to learn from the current crisis, to be more prepared for when there's the next one. And we know that how a country is doing before a shock conditions how a country will do during a shock. So it's important to have coherent and pro-health food and nutrition policy in place routinely so that it can maintain healthy food systems through shocks like that. That includes social protection and building systems that can protect food security and diets. So we see from assessments since COVID that most of the social protection that was implemented during the pandemic has now been stopped. So the challenge now is to pass and implement strong policy, not just social protection policy, but policy in support of food systems for healthy diets in anticipation of whatever might come next. Then in the diet affordability study, we saw some really clear differences, in fact, between Thailand and the Philippines. So food costs are higher in the Philippines, and the social protection available didn't fill the gap adequately. So one thing to consider when designing social protection policy and programs, especially those based on cash transfers, is whether they would cover the minimum cost of a healthy diet. And that isn't always a consideration in practice. So social protection is this broader concept than only cash transfers, but we happen to be looking at cash transfers here. And social protection, whether cash transfers or other aspects, have a wider range of impacts on nutrition than only through diets. But staying healthy through good nutrition is a really important aspect, particularly when the shock is a pandemic. And then at the social level, we saw that some people were not able to access even the social protection that was available. And we suggest that this is predictable based on marginalization of different groups. So marginalization is the treatment of a person, a group, as insignificant, as less important. And we know from the literature that a lot of food and nutrition research does look at aspects of marginalization. So it looks at the disempowerment of women, or it looks at disparities in income. But there are other axes of marginalization. There are things like age and ethnicity and disability and geographic marginalization that seem to come up a lot less often in the nutrition and food systems literature when we're looking at who is affected by these things. And then the interactions between these different aspects of marginalization that we call intersectionality are looked at and considered even less often. And then the structural determinants of marginalization, so inequitable access to services, to resources, power relations, social norms, they're all really underexplored in how they affect nutrition and how they affect policy implementation. So marginalized groups will always find it harder to maintain healthy diets in shocks like COVID. So they should be prioritized in both routine and emergency food policy and legislation. That includes social protection. So either targeting can be based on marginalization or it can be universal for everybody. And the practicalities of accessing social protection for the most marginalized really need to be considered next time. So while both the Thai and the Philippine governments implemented this range of policies to support their populations, these intersecting inequalities meant that some groups were systematically less able to access those, even while their food security, their diets were hit hardest. So that's what we found. Social protection is key to healthy diets in shocks. So social protection needs to be in place in time. social protection needs to be sufficient to afford a healthy diet, and social protection needs to be accessible to all. And as I say, we didn't start to look out at social protection, but it really did emerge strongly in each aspect of the research as an important way to support healthy diet through shocks such as COVID-19 and whatever comes next. So here are the references to these studies. We can certainly share the slides, and many thanks to all of the co-authors, many co-authors you can see here from Mahidol and other places for all their work over the past few years. Many thanks to the World Vegetable Center here in Bangkok for enabling these studies, and to the Taiwan Ministry of Foreign Agricultural Affairs for funding the work. And yeah, I'll be very happy to discuss this, have any questions. I know we probably have online people who are far more expert in social protection than me, so we can talk about the interactions between social protection and diets, which really came out clearly here. So many thanks to everyone for joining, and yeah, over to questions. Thank you.
Thank you so much, Jody. This is really an incredibly insightful presentation on the impacts of pandemic on food systems in Philippines and Thailand. An integrative look. If somebody,
Someone turn their I'm going to use this one.
sorry. Okay, it's okay now. Okay, thank you. I'm sorry about the technical issue there. Yes, so thank you, Jody. There's so much to unpack here, really, and I know that if we had more time, I think it would be really a pleasure to look into these three papers in much more detail. But yeah, as I mentioned, I think actually just to begin, I think fascinating approach to the research. So international, integrative in terms of sectoral, so economic, policy, social, mixed methods, I think we've incorporated, and the insight that you have begun to achieve and some of the implications that you have outlined are already quite clear, which is great. And I think, yeah, I would like everybody to really reflect on some of the compelling findings that Jody has presented here today. You know, we've seen how the pandemic mitigation factors, you know, have had immediate significant effects on cost, affordability, health diets, especially for marginalized urban groups. You have shown personal narratives that bring to life really the financial hardship, loss of agency experienced by many, particularly in Manila. How affordability was really a primary factor to food access. You know, food prices were a factor, but really reduced incomes, diminished capacity to earn, which led to significant dietary changes and hunger. So I think this has been, I think, incredibly important research, and I think we look forward to how this comes to manifestation in policy as we go forward in terms of research and program. I'd like to open the floor up to questions. Perhaps there are a few ways we can do this. Maybe we can begin in the room here. We have a few folks who have joined us, and then as well, if there are questions from the group online, you can raise your hand, and you can also talk that way afterward. And or if you like, you may write your questions in the chat box in Thai language or English language, and we will go ahead and translate that if needed, and we will relay them to Jody. I see Pepine already has a question, but if you wouldn't mind, Pepine, first, I just quickly assess the room here if we have any initial remarks. Thank you so much. we go by order. I saw that I find the hand first, so please, Bill, go ahead.
Thanks, Sabri. Hi, Jody. Nice to hear these the presentations and to be reminded of the work we did on COVID-19. It feels like long ago, but it's actually still very interesting to be reminded of these issues. One question we're working at the moment at ㍍Veg a bit on the urban food production, both in Bangkok and Manila as well. And I wonder to what extent your data tell us anything about the capacity of the communities to use urban agriculture or own food production as a safety net in time of shocks. It might be a fraction, right, of the urban houses that actually have access to land or container gardens. But I wonder if your data tell us anything about that. Would be interesting. Thanks.
Thanks, Pepin. Yeah, it's good to see you too. And it's really good to finish this set of studies that we did together at ㍍Veg. So we did absolutely ask about that, especially in the community study. I think Lydia might be online, so who did a lot of the analysis for that and led the paper. So Lydia, if you do want to come in, please put your hand up. From memory, although we explicitly sampled both an urban and then also peri-urban area to look at whether food production was a big kind of part of that for people with more growing space, we found in our small but very marginalized sample that it wasn't. A couple of people mentioned it, but it wasn't one of the things that sort of became a big enough issue to become a code or a theme in the work. So there are a few reasons we thought about for that. So one could be that these were such marginalized populations that they didn't have space, I mean, especially in the urban areas, or ability to access the inputs, the seeds. It wasn't. It was a specific question in the sort of questionnaire for the interviews, but it wasn't a specific focus of the work. We just asked people to tell us broadly about their experiences of food systems, food environments. But yeah, it didn't come up as much as we were thinking that it might. Lydia, do you want to? I don't want to put you on the spot, but do you have anything to add?
Sure. Hi, Jody, and thank you for the great presentation. I really enjoyed seeing all three papers presented together and the implications. Yeah, so a few initial thoughts, and Christina might even have some really lovely insights from her interviews in Manila as well. But one thing that really stood out to me was the cramped living conditions that people were describing and what some described as a concrete jungle. So very limited opportunities to grow things. Some people did describe some innovative methods where they actually were growing greens in plastic tubs that they had kept and they had filled up with soil and were growing them inside. But it was definitely an area that people really struggled with. Like they expressed the want to grow things, but had limited space or means to do it due to the very high population density. But Christina might be able to add some more insights.
Thank you, Lydia. Yeah, Christina, and then again, don't want to put you on the spot, but if you have any thoughts.
Thank you, Jody, and very good presentation, very interesting. Yeah, in the areas where we did the interviews, although the container gardening for vegetables were not something that people were thinking about. Through observation, some of the households were able to plant, but they were mostly ornamentals. So I think because the COVID was quite abrupt, I think the community didn't have that mindset at that time for planting vegetables because they were used to purchasing from markets, but during COVID were not accessible. But I think if there were an opportunity to, if the government would learn from this lesson, to really educate or campaign or promote container gardening, I think, as the communities would be more prepared for future shocks.
Thanks, Christina. So definitely, yeah, some gaps in the literature there for you, Pep, and I'm sure ㅍ is already looking at those.
We have a question from Ajahn Imorn, Udum Kesmali. Hello, Imorn, please go ahead.
Thank you very much. Hello. Hi, Jody. I really enjoy your presentation, and I think it's very, very helpful to see all those reflection, particularly with social protection being the key policy during the time of shocks. I want to also follow on with what Pepsing have say about, have you take a look at, particularly like when we talk about city area, many of the foods will come from where food come from during that time of lockdown, and what has been the issues about not able to bring into town. Comparison wise, I don't know if you have done any work that talk about community, peri-urban and outside, where they are more subsistence and they are able to, they have certain, they're closer to where foods are. And those, of course, changes the cost of how they access and of course affordable foods. So those two scenarios are not the same. I would like to then add one more observation. The COVID-19, especially for Bangkok, has brought a new, let's say, has bring something in trend, and that has to do with food delivery. The Grab, Robin Hood, the Panda, the Lineman, and they bring food to the house because people are afraid to go out and things like that. There are those, when you talk about lockdown and that happens, this thing became, when before I knew we can order things, but it has become like a routine. It has been that. For those on the outer bound, there is an area where people put a big cupboard and things, and it's similar to the food bank, but the community share what they have. So people put milk in there, carton of milk, bananas, fruit for those in the vicinity too. So those things like the thriving mechanism of what do you have to survive. I mean, of course, it's good to have a policy of social policy from the government to social protection. But what if people need to, the innovation and the things you need to survive has brought in different ways and means to access food, to share foods, to be able to do so. Wonder if that has been captured in your study. Thank you very much.
Thanks, Imorn. Yeah, insightful as always. And the context here, of course, far better, but also the policy context. So yeah, we did try to look at that kind of physical food access issue. Could people produce their own food? Obviously, COVID restrictions, we were also under COVID restrictions in undertaking the research, and they limited a little bit where we could go, which is why we focus so much on the urban and peri-urban areas in both countries. I think if we had gone to rural areas, there would have been some different learnings. You're absolutely right in both because not everybody buys all the food that they eat, and some people may have been growing even more. On the delivery apps, that was really interesting, and we did get some people talking about that. But because we were focused specifically on the poorest and most marginalized in society, a lot of the data we got on that was these people becoming the riders for those apps in order to get a bit of extra income, because of course that was a growth market during the pandemic. rather than being people who ordered that food themselves, right? So because of our sample being the most marginalized, they were riders, not orderers. So that was an interesting kind of piece there. Those of us who, you know, could sit at home and order food saw that as a really safe way to do it. And the people who were riding saw it as a way to improve their income when everything else had disappeared. And yeah, the community sharing definitely also came out. I think the point with the social protection was, do we want this safety net to be there so that people don't have to go and do all these other things like community pantries? Or do we see community pantries actually as a positive response, you know, that went alongside the kind of government policy? I think you can see it either way, but either way, it definitely happened in a big way, right? In both countries, this community sharing. So yeah, so today I've highlighted much more about the social protection issues because they came out so clearly, but there were, yeah, a whole load of other coping mechanisms, and yeah, happy to send you the paper as well. But thank you.
Thank you. I would like to get to Dr. Mulugeta, but first I think maybe we can hear from Dr. Anjali Gampur Rao has the question in the chat, kind of related to Dr. Imorn's question. She has a question regarding mechanisms adapted by consumers for achieving sustainable diets. Any use of online methods for acquiring fruits and vegetables, or changes made in consumption that can help in early preparedness. So this could be related to delivery apps, but maybe a little bit broader than that.
Yeah, really interesting. And again, I might call on Lydia, because I know Lydia did a broader study across Asia and perhaps Pacific that found quite a lot of use of online methods. So again, I think this was because we were focused on the most marginalized communities. They didn't tend to be the ones who were using these kind of online apps. I don't think that wasn't universal. I'm sure there were some, but I think there's a real social stratification for some of these coping mechanisms that we all had to use coping mechanisms, right, to get through COVID and to keep eating during COVID. And those of us who could afford to used online purchasing, those of us especially who could purchase in bulk, you know, and keep a lot of stuff in a cupboard or a refrigerated cupboard even, as opposed to people who really only had, you know, money day to day and couldn't buy online in bulk and weren't willing to pay the extra kind of 20 baht for someone to deliver it to them. So I think it's a similar kind of idea. Lydia, do you want to come in again? I know this was something you've studied separately.
Yeah, sure, Jody. And I remember we had some discussions about this during the analysis, and it was something that was really stark because I had previously worked with another team on a COVID study that was included multiple countries and multiple regions, but the data was collected on the web, so it privileged more higher, wealthier households in multiple countries, even low and middle income countries. And there definitely was a shift towards food delivery for those people who could afford it and had the opportunity for it. And it did fill some very valuable access gaps for some people, especially in places like India. Mobile food vendors were very important for people to access food, and it did happen in some places in Southeast Asia for those families that could afford it. But I think what really struck me, going from what was a slightly more privileged selection of respondents in COVID than to this study, which was very much targeting and focused on those very marginalized, was just the extremes between what could be afforded. And like you already pointed out, they actually didn't use delivery apps, and in fact they described not being able to afford to be able to order food via delivery anymore. And in fact, like you described, they actually started to use delivery apps as a way to generate ad hoc income because they had lost their main income sources because of the mobility restrictions of COVID. So it just really highlighted how the different impacts on marginalized groups can be so stark compared to maybe the more mainstream experience of shocks.
Thank you very much, Anjali and Lydia. I'd like to ask Dr. Mulugeta Handino, please go ahead.
Thank you very much. I hope you can hear me. Thank you, Dr. Jody and the research team. Extremely insightful research, and then I really appreciate the methodology as well. I mean, having also the lived experience aspect when people goes through this shock, and as you rightly pointed out, the COVID-19 was sort of, I think, a litmus test for social protection as a policy tool to address the impact of covert shocks like COVID-19. And I think it was a great moment from the policy analysis side. My question is, the first question is, you mentioned that, of course, we know during COVID-19, many governments provided systems for the people who are affected, and cash transfers became sort of a preferred tool, if you will, right? I think many governments have provided a cash assistance, and you compare that to countries as well, between the Philippines and Ireland. The question is, because you're looking at the diet, right? The healthy diet, and then of course, when it comes to food, of course, not all foods are created equally, if you will, right? If you're trying to address the issue of nutrition, cash could be used for any other food. So did you look at, in your research, the nature of cash delivered? Was it the restricted cash where the recipient would use it to access healthy and nutritious food? You know, in many cases where you could have these vouchers programs which restrict beneficiaries to access only healthy food, rather than if you just give regular cash, or unrestricted, people would use it for other purposes. So did you look at in that aspect as well? Now, the second quick question is, if I may, yes, again, related to social protection, the two countries have a strong social protection system. One of the issue that often happens in social protection is that access. So some of the people in the governments are rolling out the assistance. Some people who are not in the system, in the social protection beneficiaries, would left out. So did you look at the targeting ways? Is it open for everybody? For instance, on-demand targeting, when there is a big shock happen, beneficiaries or people in need could access the social protection systems through the on-demand targeting. So maybe those are the two elements, if you could clarify. Thanks again.
Thanks, Mulu. And it was probably clear from the questions, but Mulu is a social protection and cash transfer expert. So yeah, good questions, of course. So yeah, how to kind of integrate cash transfers with diet and nutrition. I mean, I'll come back to you at the end, Mulu, because you've probably thought about this more than I have. But my understanding is that most of the COVID transfers were unrestricted. Governments wanted to get cash in people's hands because food is one of the things, one of the reasons for that. But everybody's income evaporated, right? So they just wanted people to be able to live and survive. And so my understanding is that most, if not all of these, were unrestricted cash transfers. So we weren't able to kind of look at what people were spending this money on. That wasn't part of the design. And our design was theoretical. It was, okay, if this is how much the government recommended diet would cost, given the data that we have, and this is, you know, some average incomes, and this is how much they got from social protection, to what extent would they be able to afford a healthy diet? To what extent did they buy a healthy diet is definitely the next question, or a different question. We got to a bit of that in the lived experience work. And in the paper, there is a little bit on actual diets, like what people ate, not a survey, but an asking, how did your diets change? What did you change in terms of what you were buying? So there is a little bit of that in there, but it wasn't, yeah, the study wasn't designed in a way that could answer the question to the level that would be that useful. And then in terms of rolling it out and missing people, I think what governments tried to do initially was building on existing systems, which by definition already miss people, right? And they needed to expand those quickly. I think what we're saying with this work is that we're not social protection experts, but two things. One, consider the cost of a healthy diet in setting the amounts for these cash transfers. That doesn't guarantee that people will spend it on a healthy diet. But if you factored that in, plus sensible other costs, housing, you know, whatever else people need to spend on, then it's at least more likely. And in the Philippines, we saw that even if people had wanted to buy a healthy diet, they couldn't have afforded it with that level of social protection. And the second thing about the rollout is consider explicitly the most marginalized groups and how they might be left out of these roll calls and how they might already be left out of social protection systems and why they can't access them in order that those people are targeted. So I'm sure this is something, you know, as FAO social protection expert that you guys think about a lot, but I'm not sure that both of those things come into government planning of these things, and especially during shocks when suddenly it's urgent. So I guess the point is we need to make sure that people are thinking about this in advance. I don't know if you have anything else to add, Mulu, as the expert.
Extremely useful. Thank you so much, Jody. I mean, I think this is again, it's a missing link from the policy perspective. I know this is, I think, the area where FAO is striving to work with the governments in the region, how we can make social protection agile so that these people who are not targeted in the first, you know, in the existing program could still access from the equity side. Again, thank you so much. Really helpful.
Thanks. I look forward to discussing it with you more.
Please a bit comment of a question. In the study, you have any interview related to any village health workers or village health volunteer during the COVID time? Because I think this is actually this village health worker. This is already established long before, but this is, I think this is the law is very distinguished during the COVID time, and now the law of the village health worker even more. And from experience, for example, the subgroup urban area in Salaya, we use it to do some donations of brought food to people, and they know exactly, for example, people with a marginalized groups or out of people, they know exactly where the house, and some, for example, some house you cannot just bring the food there because no one there. You have to, for example, bring the food, put it on the road at this point, and they will collect it. And which house has, say, people that rely on the tube feeding, so they cannot eat this kind of food. I think this is also one mechanism that's already probably established before, and it's play a vital role during the COVID time.
Yeah, it's true. No, we didn't explicitly speak to those groups, and I think that might be a useful additional piece, especially in the policy type study, because we always look top down when we're looking at policy, but there are people like village health workers who know the context so well that they're almost kind of bottom up policy makers, right? They kind of make some decisions on how that policy should be implemented actually, and how the food should be distributed and things. So I think that would be a really valuable kind of additional thing to look at. We didn't look at it here. And I think there are various other groups we could speak to in trying to understand how policy gets implemented, especially in times of shock, times of crisis, and that would definitely be one. Yeah, for sure. Thank you.
㍍Adjunct. May I ask any additional questions online or from the room? Or if not, okay. I want to just end briefly with a remark that Jody, I want to thank you very much for this incredible work, for your presentation today. I think that we are really privileged to have you and your expertise, your experience represented here at Mahidol. I want to thank everybody in the room and everybody online for excellent questions and for your attendance. We are not looking forward to the next pandemic or the next financial crisis, but this research will inform responses in the future in a translatable way, I believe, and this is vital in that regard. Thank you. ㍍and goodbye from our friends from the Philippines, Thailand, and around the world. Thank you so much.
Thank you.